If you are over the age of 55 and you constantly feel like you have a lump in your throat, or you are clearing your throat every few minutes, or you wake up with a thick, sticky coating that won't go away no matter how much water you drink, I need you to listen very carefully. Because what I'm about to share with you is something most doctors never mention. They hand you antihistamines. They tell you it's allergies. They say, drink more water. But the truth is far more complex and far more fixable. Today, I'm going to reveal the 4 real, hidden reasons your throat is full of mucus after 55. And by the end of this video, I'm going to show you a simple 2-minute morning habit that can dramatically reduce that mucus, sometimes in just 3 days. Stay with me until the end, because that habit alone could change how you feel every single morning. But before we dive in, if you're tired of living with that constant tickle, that post-nasal drip, that feeling like something is stuck in your throat, please take a moment to subscribe to my channel and turn on all notifications. I share simple, pill-free solutions for healthy aging every week, and I don't want you to miss a single one. Also, hit that thumbs up. It tells me this information matters to you. Now, let's get to the real reasons. You see, when you're under 55, your body has a remarkable ability to clear mucus naturally. Your cilia, those tiny, hair-like structures lining your airways, beat in a coordinated rhythm, sweeping mucus up and out of your throat like a conveyor belt. But after 55, something changes. Those cilia slow down, they become less efficient, and the mucus itself becomes thicker, stickier, and harder to move. But here's what most people don't realize. The problem isn't just aging, it's what you're doing every single day that makes it worse. And the first reason is something you probably eat every morning. Reason number 1, the silent dairy trap. I know, you've heard this before, but I'm not talking about the obvious stuff. The milk in your coffee, the cheese on your sandwich. I'm talking about hidden dairy. The protein powders, the cream-based soups, the yogurts marketed as healthy for digestion. After 55, your body's ability to break down casein, a protein in dairy, declines significantly. And when undigested casein enters your bloodstream, your immune system sees it as a threat. It releases histamines. And what do histamines do? They trigger mucus production. So you eat a healthy bowl of yogurt for breakfast, and 2 hours later, your throat is full of phlegm. You think it's allergies, but it's actually your immune system reacting to dairy. But that's just the beginning. The second reason is even more surprising. Reason number 2, the acid reflux you don't feel. Most people think acid reflux causes heartburn, but after 55, silent reflux, also called Laryngopharyngeal Reflux, is incredibly common. You don't feel the burning. Instead, acid creeps up your esophagus while you sleep, irritates your throat, and your body responds by producing more mucus to protect the tissue. You wake up with a thick coating, you clear your throat all day, and you have no idea it's stomach acid doing the damage. I want you to write in the comments below, how often do you wake up with that thick mucus? Is it every morning or just sometimes? Let's see how many of us are dealing with this. Now, reason number 3 is something I rarely hear discussed, but it's a game changer. Reason number 3, your medication list. If you are over 55, you're likely taking at least one medication. Blood pressure pills, statins, antidepressants, diuretics. Many of these drugs have a side effect you've never been warned about. They thicken mucus. They dry out your nasal passages. They slow down your cilia. And when you combine 2 or 3 of these medications, the effect multiplies. So, you're taking a pill for your heart and another for your cholesterol, and suddenly your throat feels like it's lined with glue. You think it's a new allergy, but it's your medication. And finally, reason number 4 is the one that surprises most people. Reason number 4, the dehydration you don't recognize. After 55, your thirst mechanism becomes less sensitive. You don't feel thirsty until you're already dehydrated. And when you're dehydrated, your mucus becomes thick, sticky, and hard to clear. You might be drinking enough water, but if your kidneys are not retaining it, or if you're taking a diuretic, you're still dehydrated. So there you have it, the 4 real reasons: hidden dairy, silent reflux, medication side effects, and unrecognized dehydration. But before I reveal the simple morning habit that can change everything, let me remind you, if you're finding this helpful, please subscribe to my channel and turn on notifications. I'll be back with part 2, where I'll walk you through the exact steps to fix each of these 4 causes. And in just a moment, I'll share that 2-minute morning habit that can start working tonight. Stay tuned. Now, let's talk about the first cause, hidden dairy. You might think you've cut out milk and cheese, but dairy hides in places you'd never expect. Protein powders, meal replacement shakes, even some brands of canned tuna contain milk derivatives. Casein and whey are common additives in processed foods, from crackers to salad dressings. And here's the kicker, even lactose-free dairy can trigger mucus production. It's not the lactose that's the problem, it's the protein. So if you're over 55 and your throat feels clogged every morning, start by eliminating all dairy for 2 weeks. No exceptions, not even a splash of cream in your coffee. You'll be shocked at how quickly your throat clears. But here is the mistake most people make. They think they can replace dairy with soy milk. That's a trap. Soy is one of the most common food sensitivities after 50. It can cause the same mucus buildup. Instead, switch to oat milk or almond milk. But check the label. Many brands add carrageenan, a thickener that can irritate your gut and trigger even more mucus. So look for carrageenan-free options. Your throat will thank you. Now, cause number 2, silent reflux. This is the one that tricks even doctors. You might not feel heartburn. You might not taste acid. But acid can still travel up your esophagus while you sleep, irritating your throat and triggering mucus production. It's called Laryngopharyngeal Reflux, or LPR, and it's incredibly common after 55 because your lower esophageal sphincter weakens with age. The fix is simple but specific. Stop eating 3 hours before bed, not 2 hours, 3, and elevate the head of your bed by 6 inches, not with pillows that can actually make reflux worse by bending your neck. Use a wedge pillow or place blocks under the headboard legs. This keeps acid where it belongs, in your stomach. Cause number 3 is the one I mentioned earlier, sinuses. Specifically, chronic sinusitis that flies under the radar. After 55, your sinus lining thins and your immune response changes. You might not get the classic sinus infection symptoms, facial pain, fever, green discharge. Instead, you get a slow, silent drip of mucus down the back of your throat, day and night. Doctors call it postnasal drip. You call it annoying. But here's what most people don't realize. It's often caused by a fungal sensitivity, not bacteria. Yes, fungus. Tiny mold spores that are everywhere, in your bathroom, your basement, even your houseplants. Your sinus is becoming inflamed, trying to fight them off, and the result is that constant sticky mucus. The fix? First, buy a neti pot or a saline rinse bottle. Use it every morning with distilled water, never tap water, which can contain amoebas that are dangerous for older immune systems. Add a pinch of salt and a tiny pinch of baking soda to make it gentle. This flushes out the fungal spores before they trigger inflammation. But here's the step most people skip. After rinsing, tilt your head back and let the water drain completely. Then blow your nose gently. Do this for 30 seconds. It makes all the difference. Second, check your environment. If your bedroom has a musty smell, buy a dehumidifier. Keep humidity below 50%. and change your HVAC filter every month. You'll be amazed at how much less mucus you produce when you're not breathing in mold spores all night. Now, cause number 4 is the most overlooked one of all, your thyroid. After 55, your thyroid gland can slow down without you noticing. It's called subclinical hypothyroidism. No dramatic weight gain, no extreme fatigue, just a subtle drop in function that causes your body to produce thicker, stickier mucus. This is especially true for women after menopause. The fix is simple. Ask your doctor for a full thyroid panel, not just TSH. You need free T3, free T4, and thyroid antibodies. If your free T3 is low, even slightly, that can be the root cause. And the solution isn't always medication. Sometimes it's as simple as getting enough selenium, 2 Brazil nuts a day, and cutting back on raw cruciferous vegetables like kale and broccoli, which can interfere with thyroid function when eaten in large amounts. So, let me summarize the 4 real reasons: dairy sensitivity, silent reflux, chronic sinusitis from fungal exposure, and a sluggish thyroid. Each one has a clear, simple fix. But here's the key. You have to test them one at a time. Don't try all 4 at once. Pick the one that matches your symptoms most closely. Try it for 2 weeks, then move to the next. Your body will tell you which one was the culprit. And when you find it, you'll finally wake up with a clear throat, ready to start your day without that annoying cough or that feeling of something stuck. Share this video with someone who clears their throat all the time. They need to hear this. And remember, I'm Dr. Sarah Carter. Take care of yourself. Now, before I let you go, I want to give you one simple morning test you can do right now to figure out which of these 4 causes might be yours. It takes less than a minute and it doesn't cost a penny. Here's what you do. When you wake up tomorrow morning, before you eat or drink anything, swallow a few times. Pay close attention to what happens. If your throat feels coated, sticky, or like there's a layer of mucus sitting there, that's a strong sign of silent reflux. The acid has been pooling in your throat all night. If instead you feel a tickle or an itch deep in your throat, that's more likely sinus drainage. And if your throat feels dry and you have to clear it repeatedly, that could be dairy or thyroid related. Write your result in the comments below. I want to see how many of you wake up with that sticky feeling. It's a simple way to start identifying the real problem. Now, here's the most important thing I want you to remember. Mucus after 50 is not normal. It's not something you have to accept as part of aging. Your body is trying to tell you something. It's sending you a signal. And once you learn to read that signal, you can fix the root cause. Not with another pill, not with another over-the-counter spray, but with a simple, targeted change that addresses the actual problem. Let me give you one final warning. If you've been using decongestant sprays for more than 3 days, stop. Those sprays create something called rebound congestion. They shrink the blood vessels in your nose, but after a few days, they actually make the swelling worse. You end up in a vicious cycle where you need the spray just to breathe. That's not a solution. That's a trap. Instead, try a saline rinse, a simple neti pot with distilled water and a 1/4 teaspoon of salt can flush out allergens, thin mucus, and clean your sinuses naturally. Do it once a day for a week and see if your morning mucus improves. It's safe, it's cheap, and it works. And one more thing. If you suffer from chronic sinusitis, consider this. Many cases are caused by mold or fungi in the sinuses. The standard treatment is antibiotics, but antibiotics don't kill fungus. In fact, they can make it worse by killing the good bacteria that keep fungus in check. Instead, ask your doctor about a simple antifungal rinse. It's a mixture of water, salt, and a tiny amount of an antifungal medication. It targets the root cause directly. I've seen patients who had sinus infections for years finally clear up within 2 weeks of switching to this approach. So here's your action plan. Step 1. Do the morning test. Step 2. Pick the one cause that matches your symptoms. Step 3. Try the fix for 2 weeks. Step 4. If it doesn't work, move to the next cause. Be patient. Your body has been dealing with this for a long time. Give it time to heal. I want you to share this video with your friends and family. Send them the link, because I promise you, someone in your life is dealing with this right now. They're clearing their throat in meetings, coughing at night, or feeling embarrassed about that constant phlegm. This video could change their life. And if you found this helpful, please hit that subscribe button and turn on notifications. I'm here every week with real, honest, no-nonsense health advice. No fluff, no magic pills, just science you can use at home. I'm Dr. Sarah Carter. Take care of yourself, and I'll see you in the next video.